It's time once again for More on Wellness, brought to you by More Orthopedic. Today I've got Kristine Kealey on the phone. She's an occupational therapist and certified hand therapist at More Orthopedic's Hand Center. We've heard a lot recently about hamate bone fractures. What are the potential complications of an injury like this, and how are those complications dealt with?
The most detrimental long-term complication for an athlete as a result of a hamate fracture is diminished grip strength and pain with gripping an object such as a baseball bat or a tennis racket or a golf club. But actually, the most frequent complication of a hamate fracture is a non-union, or in other words, non-healing of the bone. This is because the fracture is very difficult to see on a regular X-ray, so it's often overlooked. A CT scan is much more helpful in identifying a hamate fracture. In the past, hamate hook fractures were treated conservatively with a cast for about 6 to 8 weeks, but studies have shown a high rate of non-healing with this kind of treatment. So all hamate hook fractures should be referred to a hand surgeon for possible surgical intervention. A few weeks after the surgery, the patient would likely be referred to hand therapy, where they would start working on exercises to restore their full range of motion in their wrist and their forearm and fingers if needed. And then once the bone is healed, the patient will start to work on more strengthening exercises for the wrist and hand and forearm.
That's Kristine Kealey, an occupational therapist and certified hand therapist at More Orthopedic's Hand Center. And that's More on Wellness, brought to you by More Orthopedics in Lexington.